Well, I think my spirits were pretty low at that time. I had lost my wife in December of '06 and struggled with that from time to time. Didn't have anything really that I really looked forward to. Well, I began to develop some chest pain and shortness of breath to quite an extreme degree. I was pretty dispirited.
Ron has coronary artery disease. He's had a bypass surgery. He has all the typical medical risk factors for that, diabetes, hypertension, and hyperlipidemia. Ron has been through cardiac rehab and pulmonary rehab, both of which have gotten him here to work on exercise and weight loss. He's also met with our care coordinator in the clinic to really work on diet and lifestyle modification. The typical doctor-patient visit is usually a 15-minute time slot, and with the care coordinator position, she can meet with Ron for a half hour or an hour.
When I came on the picture as care coordinator, he had been through several hospitalizations. He had been working with a care navigator, and she referred him to me.
We have the care coordinator to get out there and do a lot of the legwork and do a lot of the teaching and a lot of the one-on-one.
I was really relieved to see her one day when I stopped in without an appointment.
I heard that Ron had walked in the door and was not looking too well, so I went right out there and he just looked ashen.
A few moments later, I heard, "Ron, Ron," and it was Emily, and I stood up and I guess I was white as a ghost.
I was concerned I even needed a wheelchair, so I called, somebody to help me get a wheelchair, brought him into a room.
I was never so glad to see somebody in my life.
Got a doctor to come right then and there and assess him, ended up admitting him. So it was kind of a nice link there that he could feel comfortable to come in. At that point, he knew he wasn't feeling well.
But I created something of excitement here in the office that day.
But at this point, the relationship is there that he will call me if he has any questions.
Maybe my first experience with having somebody that cared about me much as a friend.
I hadn't noticed there was much family support outside of the support we were providing, and of course his physician. So I knew that we were, a pretty important role in his life, coming in and taking care of him.
I think a big part of being a care coordinator is listening and taking the time that the person feels comfortable sharing and speaking, and that you have heard what they've said.
You definitely have to be, like I said, a team player and persistence, with your patients. You have to be their advocate, We have doctors, they're working on their thing in the offices, and we as nurses really have to try to contact their nurses, and just communicating back and forth is what's really helped us take good care of him.
A lot of my phone calls were trying to get those medications straightened around for his blood pressure. He was able to come off a lot of medications, not only with his blood pressure medications, but his diabetic medications were adjusted.
He definitely progressed and improved as time went on.
I would say that Ron is in better shape now than he has been in the past year. He's now able to go out to the mall. He walks out there frequently. Things are really improving for Ron over time.
So I finally got so I could do 3 laps pretty good.
But it really comes down to living his life again and being able to get out and about and enjoy the company of other people.